Hey guys, Dr. Stephen Kosterman at Kosterman Chiropractic in Cary, and today we're talking about 3 simple tests that can help you determine whether you may have a disc injury in your spine, whether that's in your back or your neck. So the first test we're going to go through is called the straight leg test, and what it does is it's more specific for your lower back, right? But what you're going to do is you're going to sit, on your couch or on a stool or in a chair, and what you're going to do is you're going to just lean forward and kind of slump down. So like this, you're just kind of have poor posture, which I would never have you do otherwise. You're going to lean forward, and once you do this, you're going to start to extend your right leg out very slowly, or you could do your left, right? And you can try both sides. And if you start to feel some pressure or pain in your back or leg or down that sciatic nerve, odds are you may have a disc herniation or a disc injury in your back. Because what it does is when you stretch out your leg and slump, it really pulls that nerve, which attaches back to your spine. And if there's anything in the way, like a disc herniation that's pushing out in that canal, you're gonna feel some pain. And it may be pretty significant, so just do it very slowly and very gently, right? The next test we're gonna go over is called the Valsalva test. And basically, it's just when you kind of bear down really hard. So you wanna tighten up, slump over a little bit, and it's kind of like you're gonna grunt or bear down a bit. So it's kind of like, you bend over a little bit, you tighten your abs, and you just kind of strain a little bit. And what that does, kind of like a cough, a sneeze, or a laugh, is it increases the intrathecal pressure. It's a fancy way of saying it increases the pressure in your spinal canal. Normally there's no pressure on the nerve, but if there's a disc there, then it's gonna kind of push up against that nerve for a brief period of time once you increase that pressure. Kind of like, let's say this is a nerve, and you have it slammed or put in the doorway, or you have the door pushing against it one side and the door frames on the other. When you cough, it's kind of like someone slamming the door a bit briefly. So if you feel that pressure when you cough, sneeze, or laugh, and I have patients that tell me that too, they're like, "Doc, I can't even laugh. It hurts to laugh." I'm like, well, you probably have a disc bulge or herniation or some type of injury in there, and that could be the neck or the lower back or your mid back. At any rate, but the third and final test is called Mills test, and if the Valsalva test is positive, then odds are this is going to aggravate it, so be careful. But essentially what you do is you're going to lay on your back, and when you do that, you're going to lay all the way back, and then you're going to lift your legs up. Now, you lift your legs up and it starts to cause some pressure, pain in your back, maybe sharp, so do it very slowly. You'll get a little bit of ab workout during that. And odds are you have some type of disc injury in your lower back. If you ever have a question or need or anything from us, let us know. But I hope that gives you some knowledge so you can make a decision on what kind of injury you have and how to address it. But if you ever need us, we're here for you.